Gut discomfort in toddlers. Can nutrition bring a solution? Professor Yvan Vandenplas, head of the Pediatric Hospital at the University Hospital Brussels, provided interesting insights on this topic at the NNI Online Symposium, which was scheduled for the 7th International Conference on Nutrition and Growth. Common signs of gut discomfort in toddlers worldwide include predominantly functional abdominal pain disorders, functional constipation, and functional diarrhea. Collectively, these disorders have practically no organic cause, and their diagnosis relies on symptom-based criteria. Functional gastrointestinal disorders, or FGIDs, in early life not only affect babies' health in the short and long term, but may also have a short and long-term impact on family and social life, such as feeding difficulties, parental stress, depression, insecurity, and challenged family quality of life. Some functional gastrointestinal disorders that appear in early life, such as infantile colic, regurgitation, and functional constipation, can affect the development of abdominal pain in later life. The prevalence of functional abdominal pain in toddlers is more than 10% worldwide. Causes and risk factors for functional abdominal pain encompass several pathophysiological mechanisms, including visceral hypersensitivity, abnormal gastrointestinal motility, and changes in intestinal microbiota. Among the known predisposing factors are female sex, stressful events, child maltreatment, certain early life events, genetic and epigenetic modifications, and other factors. The diagnosis mainly depends on clinical evaluation. The probiotic Lactobacillus reuteri can be an option to manage functional abdominal pain in children. In a prospective, randomized, double-blind, placebo-controlled parallel study, Lactobacillus reuteri reduced abdominal pain frequency, shown as increase in the number of days without pain, and decreased pain intensity in children with functional abdominal pain. Worldwide, the prevalence of functional constipation in toddlers is reported to range between 3% and 27%, and is generally higher in toddlers than in infants. Nutrition plays a role in functional constipation. A change in the toddler's diet is the main dietary risk factor. Normal dietary fiber and fluid intake is recommended in the management of functional constipation. Very recently, the use of Lactobacillus reuteri and magnesium oxide were both effective in the management of functional constipation in young children. Professor Vandenplas further showed that formulae with partially hydrolyzed protein improve stool consistency in the majority of clinical studies. Furthermore, certain prebiotics can promote soft stools in therapeutic and preventive settings. In a prospective, randomized, double-blind, controlled study, a whey-predominant infant formula with a GOS to FOS ratio of 9:1 reduced hard stools in healthy infants in comparison with a control formula. The prevalence of functional diarrhea in toddlers is reported to range between 6% and 7%. Dietary risk factors of functional diarrhea in toddlers, often called toddler's diarrhea, include an unbalanced diet, such as a low-fat diet or excessive intake of certain carbohydrates, such as fructose, or lactose intolerance. In the dietary management of functional diarrhea, a balanced diet is recommended to avoid excessive carbohydrate intake. In case of an underlying lactose intolerance, a reduced lactose intake is preferred than complete exclusion of lactose. The use of Lactobacillus reuteri shortens the duration of acute diarrhea in a therapeutic setting and reduces the frequency of diarrhea in a preventative setting of preschool children. Functional abdominal pain and constipation are frequent conditions in toddlers. Management options of functional abdominal pain include the use of Lactobacillus reuteri. Nutrition plays a role in the management of functional constipation and includes normal fiber and fluid intake, the use of probiotics, such as Lactobacillus reuteri, prebiotics, including FOS and GOS, or a formula with partially hydrolyzed protein. In the dietary management of functional diarrhea, a balanced diet is recommended and the avoidance of excessive carbohydrate intake.